Hello, viewers. You're welcome to this week's episode. And it's still Health Watch on Advent Cable Network, Nigeria. I am Angela Emeka Ebibo. On the program today, we shall be discussing hemorrhage and shock. This topic is not much talked about, but is responsible for some mortality and serious damage to the human body. On the program today, we'll be learning how to manage hemorrhage, first aid tips, and some really good information that can be helpful to you and your family. My guest today is Dr. Oneko Ofo Abotu. She's a medical doctor. You're welcome to the program.
Thank you very much for having me.
It's good to have you. I don't normally have lots of female guests on my program. There are lots of men I get to see. And even when I get them, I don't get lots of pretty female guests on my program.
Oh, I'm
So,
blushing.
so I'm blushing. So we have a pretty medical doctor here to talk
Thank
to
you.
us on hemorrhage and shock. So thank you for coming on the program.
Thank you for having me.
All right, so I'm saying the word hemorrhage, and I'm thinking someone is looking at it. What's she talking about? Hemorrhage? What's hemorrhage? What is shock? Shock is the electricity shock. But let's
Yeah.
break it down in simple terms. What's hemorrhage? I know it's bleeding, but hemorrhage, yeah? What's hemorrhage?
Okay, so when we talk about hemorrhage, we're actually referring to acute blood loss that is
Okay.
caused by damage or ruptured blood vessels.
Okay.
So we know we have various types of blood vessels in the body. We have the veins, we have the arteries, and we have the capillaries. So
Okay.
any of them can be ruptured to lead to hemorrhage, which is also referred to as bleeding in some cases.
Okay, so the hemorrhage is when it's
When there's a rupture,
Rupture.
damage,
okay,
that
damage.
the integrity of the blood vessel is destroyed.
Okay.
So the blood vessel is housing blood.
Okay,
So
yes.
when it ruptures, it now releases its content, which is blood.
Okay, so let me take for example now. I'm holding my hand and I cut it.
Yes.
That's okay. Why do you call it hemorrhage? That sometimes you can just scratch your skin and then it's bleeding. It's
That's
just
a bruise. It may be just the capillaries that are injured, so the bleeding may not be so much. But when you
okay.
now have like when you have a small vein,
Okay.
like the one we just do during our venipuncture, we just
Okay, when you want to look for
yes.
when you want to put drip in
yes, we
somebody's hand,
intentionally
look for-
intentionally cause that injury.
injury. Okay.
Yes, to
okay.
be able to pass fluids and
Okay,
other
yes, I know if you
medication.
put it in and they draw out some blood,
Yes, of
it
blood,
comes out. Okay.
so
So
those
if
ones-
it's severe, if you cut that kind of vein, like they call it all the time,
yes,
that's another bleeding
yes,
hemorrhage.
it's bleeding. That's like a surgery. If it's surgically done,
Mhm.
it's surgical hemorrhage.
Hemorrhage, okay.
But if it's any other form, it's non-surgical. So it can be as a result of an accident, trauma, intentional cuts by
Okay.
maybe suicidal patients.
Patient,
Just
okay.
it might
Okay,
be
the
a
one they
stab.
slit here
Yeah, they
and
slit
okay.
the
Yeah,
vein.
vein
It
there.
might be a stab, a blunt injury, depending. It can be anything really. That
Okay,
could
okay.
result in bleeding.
And then there are the deep ones that can be very forceful.
Yes. Okay. The deep ones. Okay.
Mm.
Okay. Maybe I should talk about the
Okay,
types
okay,
of, so
okay,
we can
tell-
really get.
okay,
So
all right.
for hemorrhage, we have the external. That's the revealed hemorrhage. That's the one that happens on the external body surfaces
Okay.
when you can easily see, oh, this person has a cut and is actually bleeding.
Okay.
Then we have the internal or the concealed bleeding that we don't actually see, but we suspect. We have a high index of suspicion when we see somebody presenting in a certain way. When we
Okay.
see people that probably are feeling dizzy, they are coughing out blood.
Mhm.
Yes, some people cough out blood. Probably they have blunt injury to the chest, and that means they may have had accumulation of blood in the chest cavity.
Okay.
So before you know it, they start coughing out blood.
Okay.
Some people vomit blood when they have there are certain disease conditions too that are predisposed to hemorrhage, exacerbated peptic ulcer disease. That's what people usually refer to as ulcer. When someone has had ulcer for a long period of time
Mhm.
and now has an exacerbation of that disease, they can start to exsanguinate blood through
Okay.
their mouth. They start vomiting blood.
Vomiting blood. Okay.
Yes.
Okay.
That's hematemesis.
Okay.
Other people would have it past in stool. The stool is dark and tarry. So when we are trying to elicit symptoms or signs of bleeding internally, we ask so many questions because we're trying to know whether the person may be suffering from some form of concealed bleeding.
Okay.
Yes,
Okay.
so
okay.
it can be passed through. Also, some people may have parasitic infestation of the urinary tract, like what they call schistosomiasis, where people have hematuria. They urinate and there's blood in their urine. Then the most common form of most common cause of hemorrhage, which is road traffic accidents.
Okay.
They may have been involved in an accident and had sustained injuries, blunt injuries, either to the chest, the abdomen, or the kidneys, and they now start bleeding either retroperitoneum, that's at the back of the inside the peritoneum is the cavity that houses the gastrointestinal, yes, so they now start bleeding behind, and it's not really, the person just start deteriorating. That's why some people say, this person was involved in an accident, or he was okay or walking, or all of a sudden he collapsed and died.
Okay.
Because it was a concealed hemorrhage, and they couldn't identify the site of hemorrhage, and this person kept bleeding. It can be an aortic aneurysm, a big artery gets ruptured, and the person just keeps bleeding, and before you know, the person goes into hypovolemic shock and the person is gone.
Okay, so let me stay on this internal bleeding, because the external one, we'll talk about the first aid of internal when you have external cuts and you're bleeding. Now, looking like this internal one seems to be a bigger problem.
Yes, it's a bigger problem.
It's a bigger problem because sometimes you see people, I know I've heard once they said the person died of internal bleeding.
Yeah.
And you're thinking, internal bleeding?
How?
Exactly. How? What would have happened? You know, maybe this is just an outside thought, maybe just an example. There's a wrestling I was watching then, and this guy got punched, and then you see this red patch,
a big
red patch on his skin, and I was like, oh, that guy is bleeding internally. But I'm thinking a black man's skin, even if you're bleeding, you might not even see that there's anything. So how do you know somebody is if I had was somebody sitting at home, because sometimes someone has an accident and
you don't know,
and just goes on with what they're doing, and
it's that's possible. Okay, so that's why people are, for we clinicians, we usually have a high index of suspicion. So before we make a diagnosis of it, when we see a patient, we don't just rule out anything. We first of all take the vital signs. They take the vital signs like the blood pressure, the respiratory rate, the temperature, all the other parameters.
This basic one that
these
you
basic
have to
ones.
do, yes.
When you check the blood pressure of a patient that is bleeding internal or bleeding in any form, there is low blood pressure, because the volume, there's reduced volume, so the blood pressure is going to be low. So when you see a patient presenting with low blood pressure, history of trauma, the respiratory rates, because
so when you say history of trauma, which means he had some form of
if I hear, I slept in the bedroom or something,
or I had an accident, or I hit my back,
and you're presenting to me with low blood pressure, you're presenting with maybe anxiety, respiratory rates, the thing about hemorrhage, that's when we start talking about hemorrhage and shock, they are intertwined. So because hemorrhage leads to hypovolemia, which results in shock.
So hypovolemia, I mean, increase low blood hypo
volume.
Hyper.
So they now start presenting with symptoms of shock.
Oh, right. So shock now.
It's like the
destination of your
hemorrhage.
Okay.
When a person has a massive hemorrhage, before even that can happen, that's why I was like, okay, the classification of hemorrhage can be class 1, class 2, class 3, and class 4. Class 1 is when a person loses just less than 15% of their total blood volume.
Okay, and so that can be from a cut?
It can be from a cut. It can be from a cut externally, like it can be a big vessel. Like there was one case that was trending on social media about a lady that was stabbed or something, and she was just left, and she bled to death. I don't know whether yes, it was a cut. I think it was on the thigh. It was on the thigh, either the thigh or the hand, but she was stabbed. And she bled.
Was attended to.
Yes, because the people there were ignorant about how to take care of her. Yes, in that kind of case, that a roommate or anybody that is close by has a deep cut, the first thing you can do is to apply pressure on that site. If anybody had taken, even if it was a shirt or anything, and put it on that thing and just hold it tight, it would have reduced the blood loss until the lady would have been taken to the hospital, where proper care would have been instituted.
We'll talk about all those basic tips when you have cuts or you
so let me continue with the classification. So you have the first class is the total blood volume in a person is like 5 liters. That is about
Okay.
70 mils per kg for
Okay.
adults and
Okay.
80 mils per kg for children. For
Okay.
neonates,
Unit,
adults
okay.
and children is 70 mils per kg. Then
Okay.
smaller babies is 80 mils per kg. So 50 less than 15% is class 1. Then when it's 15 to 30% is class 2. When it's 40% is class 3. When it's greater than 40% is class 4.
Oh, okay.
Yes, so
That's for both
for the
in-
classification. So
Okay.
when you see a trauma patient, you want to know how much blood loss you may have had, then you now know how to classify. Then that classification will now determine what kind of care. But any form of blood loss at all is actually, it needs prompt care. You need to attend to it promptly, so that there will be no debility
Okay.
at the end of it.
So let me come back to that internal bleeding. So you are involved in a trauma, you know. So when we say trauma, people will think, oh, you're thinking, oh, you're traumatizing me. No, trauma in terms of, like, you would understand, is when
Yeah.
you've caused an impact or something has. In this case, maybe
Injury.
you've stripped, you hit your chest, or maybe in an accident you hit your chest somewhere, or you hit your hand and you don't know, you didn't, because I know one time I was involved in an accident. That whole day you didn't really feel anything. The next morning I realized that my whole body, I couldn't lift my body, and then said, oh, you need to go to the hospital to check to be sure that everything is okay. So come back to this internal bleeding. So somebody gets involved in a trauma of, what's the thing you should do? Is there any checking your blood pressure? Does it start happening immediately,
No,
or how
not
do you?
necessarily.
Yeah, okay.
So maybe we are in a scene. Let's take road traffic accidents, for
Okay.
instance. In a road traffic accident, and maybe there are some patients or some people that have bled and all that. There are some certain signs that you can check out for. You can look into the eyes. If some of them have they maybe have from their pupils, you'll be able to see, oh, this person may have raised intracranial pressure. It's possible that the person may have had an injury to the brain and is having a subarachnoid hemorrhage. Some of them you check for the back of the ear. We call it the battle sign, because you see the back of the ears is going to be red when they have maybe a fracture of the mastoid bone. You see that there's bleeding at the back of the ear. Sometimes
So you see the bleeding
you
inside.
see a black patch, just
there.
like the blunt
Okay,
trauma that you
okay,
say
okay,
on the
yes,
you see a
the-
black patch on that battle area. That they call it battle sign.
Okay.
Then some people, you see them, they have this panda eye.
How do you mean panda
You
eye?
see the eye, around the eye is black, very dark.
Oh, right. Okay. Yes.
That's bleeding.
That's very common to when the woman has
Yes,
gone through domestic
yes.
violence.
So you
notice,
see that this
Okay.
person is
So
having.
if you notice that patch around,
yes, around the.
even if you're dark, there's a bit of swelling around.
Yes,
there.
you see
Okay.
the swelling there.
Alright,
That
okay.
this person. Then some people outrightly can see cuts, maybe bleeding out
Okay.
externally. Then for some other people, they might be complaining of compression on their chest. I can't breathe. They may be
Oh.
having an injury, maybe blunt chest injury,
Okay.
and may have fractured some of the vessels, and the person is having a hemothorax, that is collection of blood in the thoracic
Oh,
cavity,
so
and
you're
pressing on the
struggling-
lungs.
Okay,
So
so
the
you're
person
struggling to
can be
breathe.
like
Okay.
labored breathing.
Okay,
You'd be like,
okay.
I can't breathe. You would have to suspect this person may have a blunt injury to the
Okay,
chest.
okay.
Yeah. So then the other some people may also be coughing and spitting out like outright frank blood.
Okay, now when we're younger, when someone starts coughing blood, say, once you started coughing blood, he has gone. No, he's dead. No,
Not necessarily.
Not necessarily.
Not necessarily,
Okay.
but they have a point.
All right.
Yes,
okay.
because the child already knows that's concealed hemorrhage. This person is coughing frank blood. That means
Yes.
there is already something
Bleeding.
that is something wrong. There's something really wrong that has to be managed urgently.
Okay.
So
it doesn't mean the person is
It's not
gone.
the person is gone then,
but
but
it can
the person
be,
needs
urgent
care.
attention. Okay.
Yes.
Okay.
So that's
all right. So if the person is coughing from the
Coughing,
mouth,
yes.
don't just sit there and say, that is it.
yes.
You
Then
need to get-
the respiratory rates, will increase. That's
Okay.
yes, because the person may have lost blood, so the system is trying to compensate for
Okay.
that when there's massive blood loss, the body compensates for it. So it will reduce blood supply to some certain organs, and it will
Increase.
send blood to, no, it will not increase, it will just make sure that the other essential organs are being perfused, like they have blood, like the brain,
yeah.
yes, the brain, the lungs, and the kidneys. They'll be perfused. So but the person with the skin, the gastrointestinal tract has a reduced perfusion. So the person may start complaining, oh, their hands are, you feel that the hands are getting cold and all that. Like you feel when you check their body temperature is getting, especially the hands, even when people are about to pass on.
Because when your hands start saying, this one your hands are cold, you're
legs,
going,
yes, the extremities too. You will check for cold, clammy extremities. That's one of even the signs of shock. So you just look for the signs, but the thing is that some of them cannot be elicited, because you cannot ask, you won't know when last person passed urine, because urine is a good indicator of whether a person is having an internal hemorrhage, because the kidney is very perfused. So as the kidney is filtering the blood, there are certain urine must be produced, and the person would all those waste products will be filtered and the good ones will go back. So if the person has not passed urine, or the urine production is very little, they have to suspect that this person may have hypovolemia as a result of hemorrhage. So there are some things that's why you see a lot of people tend to like die from hemorrhage, because most of the things that from bleeding, you have to be either a skilled person or a health personnel to be able to know, this person, somebody can actually be talking and you don't know that this person actually is more critical than this person that is bleeding as externally. You're thinking, this person that has more blood is the person we should handle fast, because he's bleeding. You can see the bleeding, but this person is on the ground. His breathing is labored and he's having internal bleeding. You just feel, this person is just suffering from pain and all that. You don't know that the person there, the other person that is quietly holding his chest is more
critical than the one that
person.
is. Wow.
Yeah.
This is
so
highly
I think when we take basic life support seriously and educate the public, it will help people in identifying all those things, and they will know when to refer. But most cases of hemorrhage, especially massive hemorrhage, they are emergencies and they should be handled in the medical facility. But the other mild ones, like just the normal cuts and all that, you will know when it's mild, and you know when to handle. Just apply pressure, clean, apply a gauze or a bandage, and when the bleeding has stopped, then you know this person is okay. You also avoid bacterial infection, so that the person doesn't have, since there's a break, and so that there's no infection. But those other ones can be managed. But when you see that even after management the person is not getting better, you still have to refer, because they are life-threatening condition. Anything that has to do with bleeding is considered very, very serious.
Wow. Okay, let's talk about shock, because very soon I want us to go to talk about women and their bleeding, but let's talk of shock. You know when you say the word shock, where the average man's mind is going to is different from where a medical doctor,
the literal shock.
And then the medical doctor is thinking shock is a serious matter.
It's a very serious matter.
What's serious about shock?
It's very serious matter.
So what's shock? Because you've lost blood, is that why you're getting shock, or what's the issue?
It's actually part of it.
Okay.
So shock is a systemic low perfusion that results in conversion to anaerobic respiration. I'm mentioning all these things because they're very important.
Okay.
And it results in reduced oxygen and glucose supply to the tissues. And if perfusion is not restored in a timely fashion, it can lead to cellular death.
So perfusion is when if the damage or the cause, the where the blood is going out from. Is it blood? Am I in the right place?
Okay, let me just break it down.
Break it down, yes,
from the
exactly.
beginning. I said low perfusion. Okay. Like I said earlier, when there's bleeding, there is low volume.
Okay. Yes.
And the low volume, the organ that sends blood to every part is the heart. It pumps
Okay.
It pumps the blood to all the parts
To other
of the
organs,
body.
yes.
Yes, like it pumps. It had all the parts of the body. If you see, they had all the blood vessels it's connected. The ones that are taking blood, the ones that are taking the ones that back to the lungs for oxygenation and back to the heart.
Yes.
So when the volume is reduced, that's what we refer to as a low. When the volume is reduced, hypovolemia. So the heart now does not have enough blood to pump to all the organs. So those organs that are not receiving that blood, they are hypoperfused. They are not having enough perfusion. The hands, all the other organs, let's say all the systems, they are not having enough perfusion. So there's reduced perfusion. So because they are not having low perfusion, the cell is the basic unit of life in all the body. Every part of the body has a cell. So they now start trying to compensate for this disease. So instead of aerobic respiration occurring in those vessels,
that is
oxygenated, instead of them getting oxygen, now there's not anaerobic respiration, and the result of anaerobic respiration is lactic acid. So this lactic acid will now build up. And we don't want that build up of lactic acid, because there will not be build up of carbon dioxide, which is toxic to the body. Yes, which is toxic, because the oxygen, there's no oxygenation, so carbon dioxide now is released and it's toxic to the cells. So if it is not restored, that's why I say it has to be restored. Emphasis on timely. It has to be restored in a timely manner, so that before that carbon dioxide will cause problem or damage to the cells or the organs, there's reperfusion, either by blood transfusion, or you quickly identify the cause of bleeding, suture it and stop the source of bleeding, and the person's system starts to return back to normal.
So you don't want that carbon dioxide to build up.
When it builds up, it's like a cascade of events. The carbon dioxide builds up, the respiratory rate, the lungs now starts going to kind of exhale to reduce the carbon dioxide in the system. But they will now cause another. In the cell, you now have metabolic acidosis. In the lungs, you are now having metabolic alkalosis, because they are trying to eliminate that the carbon dioxide that is coming. That's why we have to check for an elevated respiratory rate. That's the respiratory rate is increasing. So you know there's a problem. Why is this respiratory rate going up? So as the respiratory rate is increasing, the heart rate is also increasing, because the heart is also pumping that little blood that it has to make sure that every organ can get as fast as possible, because it doesn't want a problem to. It doesn't want an impending danger to happen. So the person will say, is that aware of his heartbeat? Is anxious? There's anxiety, or the heart. They'll say, this person's heart rate is high. So that is doing that to compensate, to see how it can reduce the that's why we ask those questions. We check for vital signs. That's the respiratory rate, the pulse rate, and the heart rate, and the blood pressure. It gives us a picture, an internal picture of the patient, to know if there's something happening. It tells us we have to look into it. That's why if the blood pressure is low, we want to know why it's low. And if the presenting symptoms will tell us, this person, they'll tell you, we had maybe chest pain, or we have ulcer disease, but we now notice so all these things work together. Is a spectrum. So if the this thing is not identified, the bleeding site is not identified, that's when the decompensation will now start, because the heart has worked, and it's tired. The body now say, let's divert blood to the brain, to the lungs, and to then the other part, that's the GI and all that. So after a while, that the blood to the kidney itself will not be enough. It will be reduced. So you see that the person is not making urine, and with time, because of those toxins in the system, with time it will cause clotting problems, like they call it coagulopathy. So it will now start those cascade, or all those activities they will increase the toxins in the body. And it will lead to either sepsis or cellular death. The organs will shut down. because they are not having. So shock is like, that's why when I was telling you, shock is like the abido shaker. Is the actual, in every medical and surgical and hemorrhagic condition, that is the final state of it. Yes, that's usually the final state of it, the multi-organ system that starts shutting down. So that's how shock is. So it is interrelated with hemorrhage because of the hypovolemia, but most conditions at the end of the day, that's the result of cellular death.
So at one point now, because at some point when you're losing, some people have surgery and they start losing blood and say, okay, we need to infuse some form of 2 or 3 or 4 units. Units of pints of blood into the person. Is it because the person is not it's not able, is losing? But sometimes the person don't necessarily bleeding,
right? Okay, so sometimes what the clinician or the surgeon is trying to do then is just trying to make sure that the person doesn't get to that level of hypovolemia, that like
the body is compensating.
So the blood he's requesting for is not aside from the helping with those other cascade of events, is to make him to buy time to identify where the cause of bleeding is. But before he can get the time, let this one be going, so that as this one is going out or something is coming in, to just like hold this thing together. But in some practices, they'll say the first thing you should do when you see some people don't even encourage you to transfuse. They say the first thing you should do when you see a person with hemorrhage is to identify the cause and take care of it before you are now thinking of transfusion, because it's just like putting water in a leaking can. So if you don't fix what is causing the leak, you are just putting it in a rolling. But some people, they use it to buy time. They use it to buy time. So that they can, the person does not go into shock. So during that process, the person is already in the hospital facility where they have an operating room, they have angiography, they have other facilities that would aid them to investigate and make sure that they find whatever it is and attend to it with in a timely fashion. Immediately.
Because I remember when I had my surgery, I think when I came out, I got up so fast and wanted to go and do. So no, I didn't bleed. They just noticed that my blood pressure dropped. I said no, don't worry. I just stressed.
No.
Then it became a little paranoid. I said no, so calm down. There's nothing wrong with me. He said no. So after 15 minutes, they checked again to come up a little. Another 15 minutes came and said, okay, let's make sure. So they were like, I said no. It's just I got up. This was the day after the surgery. I just
it doesn't.
But I'm not supposed to get, because I'm like, please, I'm tired of lying down. I've been lying there like for a long time. So I now see the importance of why they are running for it. Very important. And when you get to the hospital, they check your blood pressure, check your pulse rate, check your. So they're not just doing this. Your heart rate. So they're not just doing it for place. Actually, to check that everything is vital signs. Yes. So when you go to the hospital and they say we're checking your vitals, they're not just joking. They're very serious. It tells a lot about you. So just my viewers to know that explaining all this is to let you know that when you go to the hospital and they're taking the vital signs and the doctor say, can I see the vital sign? They're not looking for gist. It actually tells a lot on what is going on. So we'll go on a quick break, and when we come back, I think we'll talk about the women loss of blood in women, because our time is really running so fast. See how I just and then we'll talk about I think this simple first aids that we do when you're bleeding externally. I don't know if there's first aid for internal bleeding, but when we come back, we'll find out from doctor.
No first aid.
He has to go to the hospital.
You have to.
All right, we'll be right back, viewers.
Now streaming, now analyzing, now assessing, now discussing, now sharing your thoughts on everything and every issue that affects you. ACNN's Now Streaming discusses the issues trending and the matters that matter to us all. Join us every Monday to Friday at 10 a.m. on ACNN as we go in depth into every issue that impacts our lives, our communities, and our country.
Welcome back, viewers. Welcome back. We're back. My guest is still Dr. Oneko of 4, but She's a medical doctor, and we have been discussing hemorrhage and shock. And thank you so much for the information so far. You
Thank
see,
you for
so when you go
having
to the hospital, they're not playing. You know
They're
what
not
they're
playing.
looking. They're not going there to see your best friend or something. All right. So we've been talking about the shock, and I love
Yeah.
the fact that we've established that this shock thing is very serious, especially when you're bleeding. But now we want to come to women and bleeding, because I want to do this as fast as we can so that we can talk about the little first aid you can do when you're this. So women bleed. I think bleeding is synonymous with women. We bleed all the time.
Yeah, it is.
Yes, there's the monthly bleeding. Yes, that's one time, which is okay, especially when well, you don't want it overboard. Well, let's talk about I think it's postpartum bleeding, hemorrhage.
Yes,
When
postpartum.
why do you have that? And
Okay. There are actually several things that could cause postpartum hemorrhage in women.
okay,
Yes. So it's something when they call it the golden hour after delivery.
okay,
You have to make sure that you have a high index of suspicion. You have to make sure you monitor. Not that when the baby comes, that's the end of the no. You have to monitor the woman for the next one golden hour to ensure that the clotting profile kicks in
okay.
and the bleeding is secured. So sometimes the causes of postpartum hemorrhage may be due to retained products of conception. Maybe there'll be the placenta, some maybe a part of the placenta remains inside and it doesn't come out during the yes, so it will now start causing the woman to bleed. Another one is atony. They call it uterine atony. The uterus, when during the process of pregnancy, the uterus contracts. So when the baby comes out, it's supposed to now contract, like come back gradually to its normal this thing. But in some women, they may have uterine atony. The uterine is not contracting as it should. So because the uterus is not contracting as it should, and during the process of labor and during the process of child birth, the uterus is highly vascularized because it's supplying the baby with nutrients. So because of that, this thing, the woman just, some women, they call it pour. They just keep pouring.
Wow.
Yeah, so those ones are emerging. You have to make sure that there are some agents like the oxytocic agents that you place in their fluid to help with uterine contraction. So why I'm concerned about postpartum hemorrhage is because a lot of women do not deliver in the hospital or health facility. A lot of women deliver at home, and those are the ones that usually die from postpartum hemorrhage because they just feel something, maybe their first pregnancy, just feel, oh, it's just bleeding, it will go. Yes, but you now realize that it's not stopping, and the person, they'll just, this woman, she gave birth yesterday, or she cooked, she took care of the baby, she even breastfed,
so strong,
and she fell down and died, and the person will not say, we don't know what happened though, she just fell down and she just died because of the bleeding. The woman kept bleeding and there was no intervention that was done.
Yes.
So she went into shock.
Okay.
And eventually passed on.
And she didn't know because
she just feel that it's just she just delivered, so she feel that as a normal bleeding. Yes, she may feel that.
Was there any difference between when you give birth surgically, cesarean section, or vaginal birth? Is it the same thing? Can you bleed for any of them?
In any of the cases, yes, it can still bleed.
You can see, so it's not peculiar.
Yes. So some people may have clotting profile disorders, like their clotting profile does not clot quickly, so so they can bleed. They can also bleed, while some others may have maybe a morbidly adherent placenta. The placenta is so, some women may deliver normally, but because of the adherence of the placenta to the uterine wall, they have to even go through surgery to be able to take it out. Yes, to be able to take it out.
So any form of bleeding,
yes,
during after birth
is postpartum hemorrhage. No, it's not really any form of bleeding. It has a time frame. So from birth to 12 weeks, is postpartum hemorrhage, and it can occur from that. The person may not even have it in the hospital. Yes, he may not have it immediately. He may go home and all of a sudden the bleeding will now start massively, or it may not start like massive, but it will just be bleeding constantly for a longer period of time. Yes, so it also falls into postpartum hemorrhage, and it's the leading cause of mortality in women.
So it must
So
be
it's
treated very serious.
yes, it must be treated as it's an obstetric emergency.
Wow.
When a woman comes with when a woman presents or has postpartum hemorrhage, it's already an emergency.
Okay, so now, because whenever I try to do this, I say, okay, if the woman notices it, fine. But even the husband, if you notice that your wife is bleeding,
yes,
don't listen to her, say, I'm strong, I'm fine. Carry
her
her to the hospital. It's
Yeah.
because an emergency. You know, it's very, very important. So if the woman is, you know, some women like to be tough.
Strong.
You know, I said this story one time that my mom, those days when she wanted to give birth to my younger brother, she didn't want to go through CS, and you know, after talking and talking, why don't you want to? She now said they will laugh at me. They say I couldn't give birth by myself, and this was an emergency, you know.
Yeah.
So it was her time, you know. That was what they believed now. But and then people be saying, "Oh, you're okay, I'm fine." No, she's not fine.
Yeah,
Once
she
there's
needs to
bleeding,
be
yes.
attended
What
to.
of normal bleeding when a lady is just bleeding?
Okay, so
and I'm not talking about the men, because men their
don't.
bleeding is more when they have cuts. Not really. We know women have a lot to do with bleeding.
Yeah.
Apart from your period, say you're bleeding abnormally.
Yes,
You know,
yes,
just
yes. So that's recently I had someone close to me that she actually had bleeding. She had bleeding, and she went to the hospital. And when she went to the, they said she had a miscarriage. So they had to do an evacuation.
Wow.
So yes, they did an evacuation and placed her on some medications to reduce the bleeding. But the bleeding was not stopping. She kept on bleeding. So all of a sudden, like like a week or two after the incident, that she now called me and told me that I'm in the hospital. They are doing a surgery for me. That she had a ruptured ectopic pregnancy. So that's another very common cause of mortality, ruptured ectopic. So
and it can be very painful.
Yes, because it's the only way it can be managed. It's not the only way, but most times it ends up surgically. And the woman may have to lose one of her uterine tubes.
Okay.
Yes, fallopian tubes. Yeah. So that's another thing. When any form of abnormal bleeding in a woman should be treated with caution. Yes, you have to always, like, if you have to find what the cause of the bleeding was. In her own case, it was a misdiagnosis. She was misdiagnosed that she had a miscarriage. I won't say she was misdiagnosed, because even the doctor worked with the scan result. The scan said it was a miscarriage, an incomplete miscarriage. Yes, so what they did was an evacuation, but the bleeding persisted. It was when it had ruptured that when they now did the investigation, they did a uterine, another ultrasound scan, pelvic scan, and they saw that she was already bleeding into the peritoneum. But she was lucky enough to have gone to National Hospital, where care was instituted urgently. Immediately. They had already group and cross-matched blood, 2 units of blood. She was rushed to the theater. The surgery was quickly done. The bleeding was stopped, and she had 2 units of blood. She was observed. They made sure that she had come out of any form of shock before she was discharged. So bleeding is not something that should be taken lightly at all, especially even in women, not even just in women, in everybody, but in women especially. Yes, they shouldn't. Any form of abnormal bleeding that is not common or that is not normal to that person should be checked. Then some people have cervical cancer. Yes, they may have those abnormal bleeding, they won't know. So that's why it is advisable for women of reproductive or childbearing age to always do a pap smear. So that they can know the status of their cervix, to know if they are predisposed to having cervical cancer.
So any form of bleeding that is not your normal monthly
should be investigated. Any form of bleeding.
Bleeding. Or sometimes I know, when it's overly heavy, especially your monthly flow, and it's
that's when
overly heavy
uterine fibroid. Some women may have uterine fibroids. So it is something that should be investigated. In some cases, they may need to have a surgical procedure done to remove those fibroids, because as they are losing blood, as they're constantly losing blood, they are having hypovolemia. So the end result is what we do not want. So it's better to have the surgery, the myomectomy surgery, to remove those uterine fibroids, then be transfused and become stable. The flow becomes normal, so that they won't have to have any form of morbidity from
this thing. All right, so that's really beautiful, and which means even sometimes, in as much as we have all these machines, technology, medical science, things you can still get here and there, but it's always important that you're always in touch with your doctor, your physician. So even after it, and they say, okay, this is what it is, and you notice something different, it's good to actually cry out. You present it and say, see what I'm noticing. I'm not getting better. So don't keep quiet and say, no, it will stop. No, it will not stop. Go back to your doctor. Let the doctor look at you again, and then say, okay, because investigation doesn't just end when you've left the hospital. You ought to go back for your constant check. Okay, so we want to do the little first aid when you have a cut, just like we were talking about before, because I think we have only like about 10 minutes left. So now you're in the kitchen and you cut your hand. Maybe people injury, normal injury, you have a deep cut. So what's the process? What do you do?
Okay, so you're in the kitchen, you have a deep cut in your hand.
Or you're on the road, or
on the road.
Okay, road is different. Kitchen, at least there's water there.
Yes, there's water in the kitchen at least. Okay, so depending on the size of the cut, you're in the kitchen, you have a cut in your hand. You have to assess the site. Okay. Hope is not a profuse kind
so
of.
If it's going
you apply. You can apply pressure immediately before you can go to. In fact, I don't want to advise you to go to the water. Hold the place tight and firmly, and apply pressure on it. After a while, you take your hand off. Some people, the bleeding will stop. If it doesn't stop, but it reduces. Then you can now go and maybe wash off the area in case maybe there's any dirty. You wash off the area. You clean. You clean with antiseptic solutions that you have at home. Any antiseptic solution is fine. You clean with it. You can have all those antiseptic creams, Wolfgang cream, that's iodine cream. You apply on that place. Then some people have a first aid box where they have like bandages. Yes, they can apply cotton wool or a gauze there. Then wrap it with the bandage, and you can put a little plaster. If you don't have a bandage, you can apply a plaster there just so that it serves as a pressure to reduce.
Or if you don't have any of this, you can use clean cloth.
Yes, a clean cloth to hold it. And hold it down for a while. Then clean and apply those solutions, and it's good to go.
And that's the basic when you have a cut. But what if it's pulling up profusely? You can still put the pressure.
If it's pulling up profusely, you can still apply the pressure. If you apply the pressure and it's not stopping, I'll advise to apply a tourniquet. But if you have to have knowledge of how to apply a tourniquet. You apply it like a rope or a sling, firmly on the superior aspects.
On this side.
Yes.
So if you have a big cut here,
yes, you apply it here tight and firmly, and you transfer the person to a health facility. Then they will now take it from there.
Do they need to lift their hand, or just
they can lift their hand to further reduce the distance. Yes, but if you apply the sling firmly, it will stop the bleeding. But you cannot leave it there. You have to go to the medical facility.
But just before you
get there.
So if it's bleeding heavily, and on the top of it,
you tie it very tight,
so that you can reduce.
Yes, to reduce.
You don't need this side.
Apply pressure and
still tight, and find your way to the hospital. Even when maybe you see somebody in an accident scene, of course, you don't want to use your bare blood hand and put on, because you don't get.
Well, it depends on when it comes to life and death. Sometimes we just forget about the true caution, and we just want to save the person.
Save the person. So it's to put the.
But if you have the ideal thing is to put cloth and hold it there for your own safety
as well.
Yes, or you call for help so that two people, at least if another person can also apply help out with this. In fact, if there's any case, you first call for help so that when you're confused, the other person will give you moral support.
There's something they say when you have a cut and you put a cloth maybe on it to help you with the bleeding, and it's there. Don't take it out. Take another cloth and put on top so that it doesn't. Sometimes
what you're doing, you're activating the clothing mechanism. You want it to form a cloth.
Okay.
So that a clotting
That's that
plug,
thing that
that
grows,
thin film that
yes,
grows over
the
wound.
wound.
You want it
Okay.
to form a clotting plug to
Okay.
to stop. That's the physiological response
Okay.
of the body to bleeding. So if the clotting plug forms, it will stop bleeding. So why you don't want to pull out that cloth is that you may now dislodge
that
clotting plug, then you now the bleeding will now start again. So
continue.
instead of dislodging it, you can leave the cloth and then apply another one.
Okay.
Wrap it and take the person to
the hospital.
For proper
Yes, for
proper
okay,
care.
that's for basic bleeding.
Yeah.
Then if you are internal, at least we've talked about some of the signs of the internal, when somebody's having internal bleeding, you know, checking. So now, another thing I know they keep teaching is how to, in a basic way, I know you will have the professional way of looking at it, but checking people's pulse.
Okay.
You know.
So it's just to put your hand, you follow the thumb and place like 2 fingers.
Okay.
Around the radial nerve, the radial
place.
Yes, the radial artery, the outer point. You just apply pressure. You roll the artery over the you now feel it. So you count it over a minute.
Okay.
Yes, when you count it over a minute, at least it should be like 60. 60 to 80 or so beats per minute. 60 to 100 is still normal. 60 to 100 beats per minute. That's it's also give you a picture of the heart beats, because the heart is sending this thing. So that's how to get the pulse. You can also check for the carotid pulse to see if the person's carotid, but you can count it to know whether it's increased.
Okay, but sometimes when you put it just as then you know there's a problem.
When it's doing like it's pumping fast, you know, this person is having tachycardia, that's increased pulse rate. You know that there's a problem somewhere. Another thing is that when you see someone that maybe, even if external bleeding, exposure is, you have to expose the person from head to toe, because some people will be bleeding on their back. The injury will be on their back, but because you don't expose them, you not see anything. When you just raise them up, you now see that there's a pool of blood at the back. So you check and the person that you are attending to from head to toe. You remove all their clothes and check their back to be sure that there's no bleeding at the back.
Okay, very important. So because sometimes you may be looking at the front and not realize that there's something
at the back
behind.
Maybe a deep cut, and the person may just be bleeding from there. So if you don't check, you won't see.
Okay, there's something that happens when, you know, I remember those days when we do first aid training, and they'll tell you when there's an accident and people gather. You know, around the people that are involved in the accident, dragging them, and you know, they do, you know, because many people don't know, so they are trying to see how to get the person to the hospital. And of course, the distance between that scene and this, the kind of care you give the person can actually tell a lot, you know, in the life of the person. So maybe there's an accident scene. I know one of the things is to make sure the area is well aerated, that they can take in good oxygen. You know, because oxygen must, because of shock, you know, you need to remain oxygenated.
When you arrive a polytrauma scene where lots of people are involved in the traffic accidents, the way we are treated, we are trained for ABC. We do the ABC of resuscitation. Number 1 is airway. You want to be sure that the airway is patent. Some people will fall down and their tongue goes back. So you want to make sure that the tongue, you bring it down. If you have an oropharyngeal airway, you just put it in the tongue to just allow this thing to be open. You can do a chin lift. Yes, a chin lift or a jaw thrust, depending on if the person has a cervical injury. You don't want to do a jaw thrust if the person has cervical injury. You will complete the cervical injury, so the person may be paraplegic. So you don't want to complete it. In fact, for that chin lift and jaw thrust, if you don't have an idea, it's better just to leave the person like that, so that whatever injury he has will not become worse. Just open the mouth. If there's saliva or anything, or maybe foreign body that may have been there, you just try to remove it and try to open it so that the person can breathe. You can look at the nose. If there are clots or this thing, you can just find a way to remove it or suction to just see that the person is this. And then number 2 is breathing, but on the field, if there's, except you want to do if the person is not breathing, you can commence the
I think
chest compression.
We need to do a program where we have to teach that chest compression and all that.
So if you have oxygen, You can also give supplemental oxygen.
Yes,
There's
okay.
circulation now. That's where you're checking
Pulse.
for the breathing too. You're checking the respiratory rate to see if the respiratory rate is normal,
Normal, yeah.
whether the person has
It's
chest
breathing,
movement,
chest movement, yes.
not just chest movement. You see whether there is the person's breathing is labored. You can see if the person's breathing
struggling.
Yes, you see it's using other muscles to try to the chest when the chest will not be the only part of the body moving. You see other external muscles that we call them, I've forgotten, but it's like they are like supplementary. The other muscles will now you
that
see
help you
the
to-
stomach everywhere is trying to
breathe.
he's
Okay,
having
yeah.
labored this thing. You know that this person is having a respiratory problem, so you can give supplemental oxygen to reduce that labor, but on the field there may be no supplemental oxygen. So that airway that you have secured will help him. At least the nose and the mouth, there'll be some form of yes. Then the next thing is circulation. In circulation is where you are looking at the pulse rate. You are looking at the whole body from head to toe. You are seeing whether there's bleeding
anywhere.
Yes, so the bleed, it will tell you if the circulation is impaired. So you want to stop the bleeding before the other people come. You can just place, like what we said, place pressure, apply pressure, tie. You can put tourniquet, whatever you have that you can just use to stop the bleeding, so that the person's circulation does not collapse before. Then we now have I've talked about exposure. Yes, so then that's just
the basic.
Yes, that's the basic thing you can do.
wish
Then
I
you do
could-
triage.
Okay.
You look at, there are some people that you don't have to attend to immediately. The ones that are shouting. That's why you see they'll say, I was shouting in the hospital and nobody attends. All those ones that are shouting, they are most likely at least 80 to 90%
alright.
okay, because they even have the strength
to
be
even
shouting. So
yes.
like I said, those quiet ones that are just sitting on the distance and just maybe placing their hand, they are not meditating. Those are the ones that need
have this
to
attention.
Yes, attended
Wow.
to immediately.
Wow, time is over. I think I should bring you back. People do the first aid or do the demonstration.
yes.
And I should put you
No,
back.
I think basic life support should be everybody's supposed to know how
to do it. Yes, because very important.
Yeah, I even think Apricot doctor should give a decision on that, because the way a lot of people are dying, you see people videoing someone is bleeding
instead of offering help. And
something that you can easily help, even if it's just to tie and allow the person.
It's
just allow the person to
we'll have another session where we'll do the
I'll
proper
consider.
demonstration. Yeah, you will. It won't be too long from now. Thank you very much for
Thank
coming
you
on
for
the
having
program, Doctor. So for the past couple of minutes, I've been speaking to Dr. Neko Ofoapotu. She's a medical doctor, and she's been speaking to us on hemorrhage and shock. Quite expository, lots of exposition, and I've gained quite a lot today, and I believe you have too. We'll bring her back so that we can do another session where we can demonstrate some of the things she's talked about. So thank you for joining us today on the program. I'll see you next time. I'm Angela Emeka ABB. Goodbye.